Hi everyone, I welcome you all to this online lecture series on oral glucose tolerance test. Let us quickly start with the procedure that why this test is done and when it should be performed. Oral glucose tolerance test is done because it assesses that how effectively the body is processing higher sugar load. In diabetes, the elevated blood sugar levels, uh, they may indicate the impaired glucose absorption. That points towards the diabetes, and sometimes they may point towards the gestational diabetes. Okay. In gestational diabetes, pregnancy-related metabolic changes often raise the blood sugar. And after childbirth, they are usually normalized. अगर childbirth के बाद की बात करते हैं तो they are usually normalized. And usually, currently, the oral glucose tolerance test is done, and one name of this oral glucose tolerance test is the glucose challenge test. So, what is glucose challenge test? It's just the screening test which is done in most of the pregnant ladies. Just to check the risk of diabetes or gestational diabetes, if they are on borderline of gestational diabetes or anyhow they have developed the gestational diabetes, then the glucose challenge test, it will be on the higher side. So, what is to be done? It can be performed any time of the day. It involves drinking a solution of 50 grams of glucose into 50 to 300 ml of water. Blood sample is taken after 1 hour to measure the glucose level. Okay. So nowadays, according to the WHO recommendation, the glucose tolerance test is done. The sample in the glucose tolerance test nowadays, it is taken after 2 hours. But if we talk about the traditional glucose tolerance test, it was, done uh, to assess the, to assess that how your body is responding to the glucose, but the sample is not exactly taken after 2 hours. So if we talk about the glucose tolerance test, it requires the overnight fasting. A baseline blood sample is taken. 75 grams of glucose is dissolved into 50 to 300 ml of water. And, for children, this dose can be adjusted. So patient should be at rest while performing this test. Okay. So now let's move on to the outline. The ability to utilize carbohydrates can be determined by performing the glucose tolerance test. Initially, in the initial stages, the fasting blood glucose is estimated. After that, the loading dose of glucose is given to the patient under consideration. And the blood glucose levels are estimated at regular intervals after the glucose load in conditions of you know, in conditions like insulin deficiency. If a person is having insulin deficiency, blood glucose level gets elevated because there is impaired absorption of glucose. The glucose absorption is impaired. So let's talk about why the glucose tolerance is decreased. Why? In a patient, the result is showing the decreased carbohydrate tolerance. That means the carbohydrate is not being utilized. The load given is not being utilized by the body. It remains in the blood. So when it is not being utilized by the body, it remains in the blood. It happens excuse me, it happens in the case of diabetes mellitus. It happens hyperactivity of anterior pituitary and adrenal cortex. It happens in hyperthyroidism, and yes, it can happen in stress as well. Okay, so if we talk about the increased glucose tolerance, so it happens when the pituitary secretions are not proper, hypopituitarism, when insulin is not there. Okay, when insulin is not there, sorry, when insulin is in greater amount, in large amount, okay, then there is increased glucose tolerance because the insulin tries to push more and more glucose inside the cell. When a patient is suffering from hypothyroidism, and in certain adrenal cortical hypofunction, decreased gastrointestinal absorptions like Sprue and celiac disease. So let's now understand that when do we require the glucose tolerance test, oral glucose tolerance test, and when not. So in a proven case of diabetes mellitus, the test is not required. When we know that the person is suffering from diabetes mellitus, then the test is not required. Why? Because simply we will then test the fasting blood glucose. We will then test the PP blood glucose. We will then test the HbA1c, the glycosylated hemoglobin, when we know that the patient is suffering from diabetes mellitus. Okay, so glucose tolerance test is required only whenever there is a doubt in doubtful cases. It is not recommended for follow-up of a patient, and the test, it should not be carried out in acutely ill patients because see, it's against the ethics also, and if a person is acutely ill suffering from diabetes and in a critical condition we are administering the glucose orally, the blood glucose level may increase or it may pose additional side effect. Okay, so it's not recommended in critically ill patients. So now let's talk about how the patient is being prepared and what are the precautions the patient has to follow. The patient is instructed to have a good carbohydrate diet for 3 days prior to the test. And the diet containing about 30 to 50 gram of carbohydrate should be taken on the evening prior to the test. It is mandatory, and these guidelines are given, previously when the patient is about to come for testing. So the patient should avoid certain drugs likely to influence the blood glucose levels for at least 2 days prior to the test. And the patient should be abstaining from smoking during the test. He should not perform strenuous exercise on the previous day. And exercise is also to be avoided on the same day prior to the test. So he should not be performing any physical strenuous activity or any exercise. So now let's talk about the types of oral glucose tolerance test. One is the standard oral glucose tolerance test. Another one is the intravenous glucose tolerance test. And next is the mini glucose tolerance test, which is very popular these days. This is very popular these days because, with the changing time, the lifestyle is also changing. People are very much busy. They do not want to, wait in lines, wait for to perform any test because since everyone is busy in their daily schedule. Okay. So when we talk about the, oral glucose tolerance test, traditionally at about 8 a.m., the fasting blood and urine samples are collected. Why this is collected at 8 a.m.? Because from 8 to 8, let's say the patient has his dinner at 8 p.m. in the last night, and then in the morning, he or she is being administered the glucose for the oral glucose tolerance test. In the morning time at 8 a.m., the fasting blood glucose is taken. And this, as I previously told you, this is known as zero sample. After that, 75 gram of glucose is dissolved in 250 to 300 ml of water and is given to the patient. But in case of children, the dose is adjusted for 1.75 grams. And in the classical procedures, the blood and urine samples are collected at half-hourly interval. That means first sample, 0 hour sample in the morning, and immediately the patient is given glucose to drink, and then exactly after 30 minutes first sample is drawn. Okay, exactly after 1 hour second sample is drawn, exactly after 1.5 hour third sample is drawn. So glucose is estimated all in the blood samples, and similarly urine samples will be taken, and these urine samples will also be analyzed for the presence of glucose. See, usually in normal cases, urine doesn't come in the, shows the presence of glucose. shows the presence of glucose because glucose is reabsorbed. Okay, so it doesn't show the presence of glucose in normal cases. But yes, in this case also we will check the urine for the presence of sugar, carbohydrate. After that, we just plot a curve with the blood glucose levels on the vertical axis. On the vertical axis, we will be plotting the glucose levels, and on the horizontal axis, the time, let's say 0 hour, then 30 minutes, then 1 hour, and so on. So the curve obtained so is called the glucose tolerance curve. So the curve obtained will be the glucose tolerance curve. Okay. So in case of normal blood glucose profile, we can see that the blood glucose level is within the normal range. First of all, the 0 hour sample is 90, which is also within the fasting blood glucose range. Let's say we have 70 to 110 mg per dl according to the standard data. This is the normal blood fasting glucose level. So here it's showing 90. It's normal. So अभी कहीं कहीं जगह पर ये 125 तक भी normal मानते हैं fasting, है ना? According to the procedures and according to their protocols and their standardized limits. फिर एकदम से आप देखते हैं कि 30 मिनट्स में 100, दैट मींस ग्लूकोज धीरे धीरे ब्लड में एब्जॉर्ब होना शुरू हो गया. देन 150, देन अप टू 90 मिनट्स 120, एंड देन आफ्टर 120 minutes it began decreasing. Why it's decreasing? Because of the action of the insulin. In normal cases, we are talking about the normal blood glucose profile. So insulin is there, and insulin is also acting on the blood glucose. It is dragging the blood glucose inside the cell. When it is dragging the blood glucose inside the cell, that means the glucose level will decrease gradually, after certain time. Okay. So, if we talk about the diabetic curve, the oral glucose tolerance test curve in the diabetic patients, so we generally see that fasting blood glucose is higher than normal. Highest value is attained at 1 hour to 1 hour 30 minutes, and the highest value usually it will be more than the renal threshold. More than the renal threshold. Glucose will be found in almost all the urine samples in the diabetic curves. Okay, it will be found in all the urine sample because the diabetic patient बहुत ज़्यादा blood glucose होगा, so it will be found in the urine also. The blood glucose levels does not return to the fasting level even after 2 hour 30 minutes in diabetic patients. Okay. So now this is the, you can see the blood glucose levels, they are above 200. They are not, coming down even after 180 minutes. So yes, this is the oral glucose tolerance test of diabetic patient, and you can see the glucose is also found almost in all the patient, which in normal case it is not found. In normal case it is not found. Okay. So now there are patients who have certain absorption problems. They cannot absorb the nutrients properly. So for such patients, there is intravenous glucose tolerance test that is, administered. So अगर किसी को celiac disease है, कोई enteropathies है, so in this case, the intravenous glucose tolerance test is done. And under these conditions, oral glucose load is not well absorbed. सो ओरल ग्लूकोज टेस्ट का कोई मतलब नहीं बनता क्योंकि जितना भी ग्लूकोज लिया है वो एब्जॉर्ब नहीं होगा. ऐसे में इंट्रावीनसली ग्लूकोज दिया जाता है. सो इन दिस केस 25 ग्राम ऑफ ग्लूकोज इज डिसॉल्व्ड इन 100 ml ऑफ डिस्टिल्ड वाटर एंड इज गिवन एज इंट्रावीनस इंजेक्शन इन विद इन 5 मिनट्स. 5 मिनट में उसको इंट्रावीनसली इंजेक्शन के थ्रू चढ़ा देते हैं. एंड देन इसकी inference देखते हैं. The peak value is reached within a few minutes and the value touches near normal 45 to 60 minutes, and according to this the conclusion can be drawn whether the patient is diabetic or okay. So in normal individuals, blood glucose level returns to normal within 60 minutes. If the blood glucose level return normal within the 60 minutes in the intravenous test, Okay, then this indicates that the patient is not suffering from diabetes. But in diabetes mellitus, the decline is very much slow. The initial values are attained in 120 minutes. So इसी से हमें पता चल जाएगा कि patient को diabetes. Okay, so there is also another test known as mini glucose tolerance test, which I told you previously. So it is done as per the current WHO recommendations in mini mode, because only two samples are collected. One is the fasting 0 hour sample and another one is the 2 hour post glucose load. So urine samples are also collected during the same time, and the diagnosis can be made from the variations that will be observed in the results. So nowadays, the number of samples, 2, 3, 4, they are not collected. Only the 2 hour post-glucose load is, assessed. So that's all for today. So in case of any queries, you can just comment down and stay tuned in for the next lecture. Thank you so much.